friends, welcome to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers. I am Angela Yarborough and this is Dr. Jerry Yarborough. And what are we doing here? Well, we are talking about different disease processes, and we are just talking about different ailments, different things that keep you from loving your life. That is one of our mottos, is love your life. And we just wanted to give back to the community and just give you some things that you can do for some things that might be preventing you from loving your life. So why don't you tell us exactly what we're going to be doing?
All right. First, like you said, I'm Dr. Jerry Yarborough, physical therapist, and my sweet wife, Angela. By trade, she's actually a nurse. So, together, I opened the Jonesboro Clinic about 20 years ago. I actually have about 27 years experience as a therapist. And then 7 years ago, we opened up here in Ruston. And just about 3 weeks ago, we opened up in El Dorado, Arkansas now. So what we're doing, like she said, is we're talking about different diseases or impairments that are affecting your quality of life. And at Physical Therapy and Balance Centers, our desire is to help you love your life. So we're going to discuss those impairments. We're going to discuss how physical and occupational therapy can help you rehab from those impairments. And then we're going to always give you a takeaway of what you can start doing immediately to start making a change in your life and improving your quality of life. So again, come and see us every Thursday here on Louisiana Living. You can look us up on myarclemist.com or our personal Facebook page, physicalruston.com. Or you can even go to our Facebook page or even our YouTube channel. We have lots of videos and lots of education out there to help educate the community. Now, we want you to come back in the next two segments in which we'll start talking about certain ailments or impairments. And then, like I said, what physical and occupational therapy can help you overcome those impairments. And then again, we're always going to leave off with what you can do immediately to start helping improve your quality of life. So come back and see us and we'll get started. Thank you.
Hey, welcome to Therapy Thursdays. We are Physical Therapy and Balance Center on Louisiana Living. I'm Angela Yarborough, and this is Dr. Jerry Yarborough. Today, we're continuing our series on autoimmune diseases, and today we're going to talk about this long word, ankylosing spondylosis. So, what is that?
All right. So before I get into the definition of that, I just want to recap real quick about what autoimmune diseases are. And again, I'm going to ask you to explain very basically to everyone, what is our immune system?
It's just the system that God put into our bodies that keeps us well.
That's right. So what autoimmune diseases are caused from is that defense mechanism that God put within our bodies to protect us starts to attack us. It gets a little confused. So a lot of the common first signs of autoimmune disease, can be pain, spasms, headaches, fatigue, weakness, imbalance. All of those things, or a lot of those things, are repetitious throughout all the different autoimmune diseases. And there's actually over 80 different autoimmune diseases, and they're discovering more and more all the time. And each one even actually has spectrums within that. So like last week we talked about rheumatoid arthritis, and now this week we're talking about ankylosing spondylosis or spondylitis, however you know it. All right, so what that is it's arthritis of the spine more commonly. It can affect other parts of your body, but most commonly it's going to be of your spine. All right, so what happens, and it typically happens in adolescent boys more than anything. That's when it starts, and they have a lot of stiffness and pain in the lower back or their SI joints, which is where the sacrum, or in the pelvis area. And so all that inflammation ends up causing deterioration and it ends up where the vertebra or the bones of your spine actually fuse. So you end up having no mobility of your spine because of ankylosing spondylosis or itis. It is a progressive disease, and like I said, it affects adolescent boys up into manhood way more than it affects women, but women can definitely have it also. It's very debilitating and can be very painful. So come back in the next segment and we're going to talk a little bit more about what specifically therapy can do and what you can do to start trying to manage the symptoms that you have with ankylosing spondylosis. All right, thank you guys.
Welcome back to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers, Angela Yarborough and Dr. Jerry Yarborough.
Welcome.
And today we are going to continue our talk on autoimmune diseases, and we're talking about, I forgot the word now, ankylosing spondylosis.
That's a hard word.
It's a big word.
Pretty long. It is pretty long. It is an autoimmune disease. Remember, that's where your natural defense system starts to attack your healthy cells. And there's over 80 different autoimmune diseases. Ankylosing spondylosis affects typically adolescent males, and then throughout life it's progressive. Women can be affected also. More commonly than anywhere else, it is an arthritis of the spine, starting in like your SI joints, which is down in your pelvis region, and your lumbar or your lower spine, and it just can go all the way up to your neck. It can also affect different parts of your body, but again, most commonly it is the arthritis of the spine, and it causes an inflammation, and that inflammation deteriorates the bones and causes them to, the vertebra, the bones of your spine, to fuse together, so you lose that mobility completely. And there's no cure, and there's no reversing it per se, but it's very important that you follow up with your primary care providers and get on the proper medicines to help manage it. But also physical or occupational therapy is a key component to your management of ankylosing spondylosis. So the things that therapy is going to do to help you manage it is, your muscles are going to get real stiff, so we got to do some massage, we got to do some stretching, we got to do a lot of strengthening. Remember, God created our muscles and our bones to work together, and if our muscles are weak, then it puts a lot more work on our bones and causes them to degenerate even quicker and causes more pain. So it's very important that we stay as flexible as you can, because remember, ankylosing spondylosis is causing fusion of your spine to decrease your mobility. So you got to stay as flexible as you can. You got to keep your muscles as strong as you can. Now in therapy, we got different modalities and different things that we can use. Here at Physical, we're certified to do trigger point dry needling. That's one thing with the tight muscles that we can do to help relax the muscles. In addition to the soft tissue work that we do, the strengthening, other modalities like we have here at Physical locations is we have our Class 4 laser. And that's an accumulation of light energy, penetrates down to that cellular level and helps repair or provide energy to those cells to repair. So again, to manage your ankylosing spondylosis, it's very important that you follow up regularly with your primary care providers. And many times you're going to be referred to a rheumatologist to help manage that. And they're going to have you on different medications. The drug companies are always coming up with new things, and they got some new things for this disease. So it's real important to follow up with your primary care provider, but definitely don't want to leave out your therapist. They're a very key component to your management of this disease. So hopefully this was all very helpful to you, and we look forward to seeing you again next week.